welcome everyone. My name is Danny Soto. I'm your presenter today. So today's presentation is on alternatives to 911, more specifically alternatives to police response to crisis and community-based crisis care. And then just a quick introduction from myself. My name is Dr. Danny Soto. I'm the Associate Director of the Research and Action Center here at Impact Justice. I've been with IJ for 6 years this month. And my background is in sociology, criminology, with a focus on juvenile delinquency, adolescent well-being, and that kind of thing. And so my intersection with the CARE TA Center work is mostly around justice diversion. As I'm sure all of you are familiar, a lot of folks with mental health, behavioral health issues, folks who are in crises of various kinds, often end up kind of swept into the criminal justice system, which is not always an ideal system to address their needs. And so that's kind of the lens and the perspective and expertise that I bring with me today. Our learning objectives today is to hopefully share an understanding of what community-based non-police crisis response can look like, have an understanding of the effectiveness of these alternatives, and how these alternatives can decrease criminal justice system involvement. So we know that in our country and in our systems, folks with mental and behavioral health issues are at risk of being victimized and are also at higher risk of being arrested. And so all of these things kind of encompass criminalization. Police departments and jails are now the de facto frontline mental health workers. In California and across the country, county jails are the largest mental health care providers. Even though, police departments and jails are not the ideal environments for treatment, right? And often lack the specialized training that they need in order to be effective. And we also know from lots of research that folks with mental and behavioral health issues often worsen in the justice system. And this creates a cycle of worsening health and well-being, and then further system involvement, and then worsening health and well-being, and just this kind of cycle. Some folks even refer to it as kind of the revolving door of incarceration. And of course, these have ripple effects not outside and beyond the criminal justice system. There's also increased risk of further and repeated emergency room utilization and increasing risk of homelessness as this cycle continues on. And so clearly there is, a need to kind of re-examine how our systems and how folks with mental and behavioral health needs are kind of flowing through these systems. Some additional kind of figures to give additional context here. Across the United States, there are over 240 million calls to 911 each year. So there's a large volume of calls and requests for services or reports of incidences. But when looking at the reasons for these calls or the requests that these calls are for, less than 4% of these calls are related to violent crime, right? Violent crime I think the consensus is that's really the purview of law enforcement, right? We want, police response oftentimes to violent crime, but that's really less than 4% of those 240 million calls every year. And unfortunately, one of the consequences of police response to non-violent situations is that every year around 200 people displaying mental illness symptoms each year are killed by police. And these are often seen as preventable incidences and situations that could have been better addressed by folks with more specialized training and who have expertise in de-escalation and things like that. And so police response to these kinds of situations is not necessarily effective. And so just to reiterate here, right? So millions of calls are made to 911 every year, but most do not require an armed police response. Even in cities with high homicide rates, less than 4% of calls were for violent crimes. So even even in situations where violent crime is higher than the national average, it's still not exceeding 4% of calls. The majority of calls, the most frequent reasons that we see are related to disorderly conduct, noise complaints, suspicious looking people or cars, or cars or people that folks think are suspicious, mental health issues, substance use, and homelessness related issues. And unfortunately, in addition to those 200 folks per year who are displaying mental health symptoms, armed police responses result in more than 1,000 deaths of civilians per year. And more than 50,000 are wounded every year by police. Of course, law enforcement experience harm as well in violent situations. But these non-violent calls for service can be addressed differently. And so there has to be a better way to respond to crisis. What we see actually is that there is a lot of public support for community-based solutions, for non-police solutions. One national survey in 2020 conducted by the Alliance for Safety and Justice and the National Coalition for Shared Safety found that 80% of voters support mental health professionals responding to mental health crises instead of police. And 80% of voters support increased funding for violence and crisis prevention, where police response is an intervention, right? The vast majority of folks surveyed support increased funding for prevention. Another national survey conducted by Safer Cities found that 73% support creating a whole new agency of first responders to reroute mental health and homelessness calls away from police, and to clinical professionals. So not just some kind of coordination with police, but a large majority of folks are also in favor of support of creating a whole new agency to respond to these kinds of needs. And over the past 40 years, we have continued to see, even though crime over the past 40 years overall has been on the decline, both violent crime and property crime has been on the decline over the past 40 years, we have seen budgets and spending amounts increase. So we've seen dramatic increases in the amount of money spent on public safety. But this investment has largely been in growing the criminal justice system as a whole, right? Not just police, but the whole infrastructure of our criminal justice system. Instead of investing more of those public safety dollars in prevention programs, right? Violence prevention, mental health treatment, trauma recovery programs, substance use programs, and homelessness support. Here's a quote from that report that I referenced earlier from the Alliance for Safety and Justice. Everyday Americans largely agree on what needs to be prioritized to improve public safety, right? In terms of prevention. However, current government priorities do not necessarily match the public's expectations. So as a whole, our society would like to see more investments in prevention. So we just looked at kind of what public opinion is focused on. And when we survey or interview police, courts, corrections staff, they all agree. They agree that the untreated mental health and or co-occurring substance use disorders are core drivers in the cycle of crime. And they also agree that they lack the infrastructure to respond appropriately, right? The resources, the training, the partnerships with other specialized centers and agencies and organizations, that those really aren't there. And so we're kind of left with what, by all accounts, is kind of an inadequate response by the criminal justice system. And so what are some of the alternatives that are being explored? Obviously, this is, at least in my field of kind of criminal and juvenile justice, this is a big conversation that's going on right now, is like, what are some community-based alternatives to police responses? And so beyond just the conversation around it, which is really exciting and promising, what are folks actually doing as alternatives? So first of all, what does effective crisis response look like? In a healthy community, right? A healthy community is an ecosystem, right? And has the resources that the community needs to thrive, right? In terms of health, in terms of education, in terms of safety, basic needs like housing and access to healthy food and all of these things, right? So a healthy community is a healthy ecosystem, and effective crisis response is an essential component of a healthy community ecosystem, right? Crises will occur, and so having the resources and the responses ready is part of that, part of a healthy community. Effective crisis response is also part of a continuum of care that includes prevention, intervention, and aftercare, right? So it's not only intervention. When we're talking about the continuum of care, right? We're talking about prevention, intervention, and aftercare. And communities across the US have been developing and implementing innovative community-based alternatives to armed police response to crises with success, with a lot of success. And so here's kind of an illustration of the most of the models that we've seen, and we're going to go over some examples, and they all have nuances and differences between them, right? But they tend to be, the most successful ones tend to be organized in a way similar to this here. So if you look at the center kind of illustration there, right, in the purple box on the left, we see community-defined approaches and community-defined metrics of success. So the community and the community members are leading the way in terms of what is needed, what does success look like, how are we measuring success, and what approaches are going to work in this community, what approaches is our community going to respond to, what's going to work here, right? And then on the system side, in the blue box to the right, that's where we see system-led coordination and budgetary support. So this coordination is a really essential role that we've seen when community members and community organizations sometimes try to do coordination on their own, independent of systems. It can be really difficult. It can be a really heavy lift for programs whose main mission and goal is to provide direct services, right? So having strong coordination and collaborative relationships with system partners can really help strengthen the system overall. And then, of course, with budgetary support, right, from whether that's federal, state, local, county level, that kind of thing. Turning again to the community side of this partnerships, right? I believe, and I think that research also points that those closest to the problem are also often closest to the solution. Those are folks who have lived experience. They've often seen what's been tried and what hasn't worked in the past. And folks who live in the community and are members of the community are the experts on that community, right? Innovation rarely comes from established institutions. Established institutions are good at what they do, and they can often become more efficient at what they do, but it's difficult for established institutions with processes in place, often bureaucratic. There's more levels of policy and review and things like that. It's more difficult for those established institutions to be nimble, to be innovative, to be responsive to change. And this is really where smaller, especially grassroots community-based organizations can really excel in terms of being nimble and responsive and being able to pivot. And so we see a lot of innovation at the grassroots level. And so impacted communities and their knowledge must be centered. They have a great deal of expertise that they can bring to the table that make partnerships like this and efforts like this really successful. On the system side, right, these system-led coordination, system partnerships are also an essential piece that is necessary for success, especially when it comes to stability. right? So where those established institutions maybe aren't able to be as nimble or innovative, they certainly can bring stability, right? They can bring stability to a collaborative or to a partnership. And of course, stability is essential for sustainability. Systems must remember that they have to be willing to make meaningful investments in public safety beyond just law enforcement. So a lot of folks, a lot of the public, and a lot of us often think about, when we think about public safety, we think about law enforcement, we think about police, we think about a criminal justice response. But as we've talked about, and as we will see, public safety is beyond just that, right? And of course, prevention should be an essential, large component of any approach to public safety as well. And then local grant programs should be robust in funding, right? So, ensuring that programs have the resources they need to keep their valuable employees, to respond to the needs effectively that they're trying to respond to, and that kind of thing. And so both halves of this, I guess, both parties or both halves are necessary for this an effective strategy. The first example we'll look at is actually the oldest example in the United States of a community-based partnership with police. This is CAHOOTS. Many of you might already be familiar with them. That CAHOOT stands for Crisis Assistance Helping Out on the Streets. And they started in 1989. And this was funded through the city of Eugene, Oregon, through the police budget. So this was explicitly a partnership with police. And the way that this was set up was that both a police officer and a crisis responder would respond. And we still see models like this today, where it's a paired kind of dispatch, right, with a law enforcement and a social worker, a paramedic, some other kind of responder would pair up. That relationship has evolved, the model has evolved, and so today, two-person teams are still dispatched, but there's no armed police unless they're called for backup. And police can also call for CAHOOTS backup. So CAHOOTS and the police here in Eugene have had obviously a very old, established, trusted partnership. So police can call CAHOOTS, CAHOOTS can call police. And CAHOOTS has greatly expanded from their initial kind of pilot first couple of years. In 2019, CAHOOTS responded to about 24,000 calls. And that represents only about 20% of total calls. So 24,000 calls, right, is only this a small slice of the pie. And so clearly there's also the potential for expansion of this program. Out of those 24,000 calls that CAHOOTS responded to, only 311 required police backup. So their dispatch is doing a really great job of, routing calls for service appropriately. And so today, crisis responders receive at least 40 hours of class time, and new staff complete 500 to 600 hours of field training before they can join a two-person team. So this is really intense, and these folks are clearly highly specialized, right? Which no doubt, leads to their effectiveness. Something else to point out here is that even though it does take a lot of investment before a crisis responder can actually start responding as a member of the team, this program still operates within about 2% of the police budget. So the police department is still the primary funder of CAHOOTS, even though police are not dispatched unless they're called. So clearly, really efficient way of responding to crises as well, because they're able to respond to about 20% of total calls within only about 20% of the, 2% of the police budget. Another example is in Denver, Colorado. So this program is called Denver STAR. That stands for Support Team Assisted Response. And this is a mobile crisis response program that sends healthcare experts instead of armed police. So this is a instead of kind of model. And typically they pair a mental health clinician and a paramedic who's specially trained in crisis response. An evaluation was conducted by Stanford recently, and they found that the Denver STAR program significantly reduced crime. In the first 6 months, they reduced low-level crimes by 34%. And this was both because STAR responders were better able to de-escalate a situation, to bring everything back down, whereas, as we know from other research, police responses often escalate, right? When an armed police officer, tries to intervene or, tries to de-escalate, it often just kind of triggers an escalation, right? So they were better equipped to de-escalate situations that would have likely otherwise been recorded as an offense or a crime and subject to citation or, even arrest. So that piece we would refer to as diversion, right? So they were able to just not even require an interaction with the criminal justice system at all, in 34% lower crime rates there in low-level crimes. The other way that crime was reduced was because the Denver STAR program was able to reduce recidivism among clients. And so reducing their kind of quote unquote reoffending in the future, right? And this effect was seen even during the times of day when STAR was inactive. So the Denver STAR program is not a 24-hour-a-day program, but even at the hours when they were not active, their clients were still less likely to recidivate than if they had a traditional kind of police response there. And so the impact of this program goes beyond just diversion, and it also goes just beyond deterrence. It also reduces recidivism. And when it comes to criminal justice research and looking at criminal justice outcomes, reducing recidivism is kind of the gold star, right? And this is something that law enforcement alone has not been shown to do. There's no research suggesting that police contact reduces recidivism. And in fact, there's a body of research that shows, especially in drug use related crimes, police intervention actually worsens outcomes and increases crime. So this is significant. This is a significant success here. The other piece of success here is that it also significantly reduced costs. So the direct costs of having police as first responders for crises involving folks with mental and or behavioral health crises was 4 times higher than the cost of Denver STAR's response. Remember, they have a mental health clinician and a paramedic responding. And this is just direct costs. The evaluation done by Stanford, they kind of said in their evaluation that they were limited and weren't able to look at all of the indirect cost savings associated with effective referrals, right? Reduced recidivism, that obviously saves money. Reduced emergency room utilization also saves money in the long run, but they didn't have the data. They needed to really dig into those cost savings. And the Denver STAR program is funded by the city of Denver through the Mental Health Center of Denver. Another example closer to home, I'm here in Oakland, California. Just across the bay, we have the Street Crisis Response Team in San Francisco. And here in this situation, 911 dispatchers are specially trained to route folks who are in crisis to the Street Crisis Response Team. So this is an example of alternative dispatch approach, right? So people are still physically calling 911, right? But the dispatcher is trained on how to route those calls for service. And so the Street Crisis Response Team consists of a community paramedic, a clinician, and a peer specialist. And oftentimes those peer specialists are folks with lived experience, folks, who are part of the communities where they're operating, and are often really effective at de-escalation and connecting with folks who are in crisis and may not trust strangers, or folks who are unfamiliar to them. And there are 7 teams spread throughout the city. So since November of 2020, the crisis response team has handled over 15,000 crisis calls, and this represents 77% of all eligible calls in the entire city. So for all calls all calls related to folks in crisis, they were able to respond to 77% of those, which is pretty impressive. Their average response time is 17 minutes. They are working to reduce that response time. And fewer than 1% of those incidences that were responded to resulted in violence. So they were very effective in terms of de-escalation and not needing to use force at all or respond to violence, because the incident never escalated to that point, right? And then in San Francisco, there's also an Office of Coordinated Care that follows up with folks in order to link them with treatment and other services beyond just the immediate kind of crisis intervention that's needed. The Street Crisis Response Team is funded by the city and county of San Francisco. And so additional alternatives are spreading. Even as I was doing some background research, brushing up on research and different programs for this presentation, I was stumbling on more and more, kind of programs being announced. So obviously it's kind of too soon to see, has there been an evaluation done of them and things like that. But, this is becoming a very popular, isn't necessarily the right term, but kind of popular approach. And folks are really showing increased willingness to consider alternatives. And so you can find examples in Newark, New Jersey. There's a program in Albuquerque, New Mexico that has attracted a lot of attention. So it's easy to find, kind of news articles about it and stuff. Also, there's a program that's been piloted here in Oakland as well. But some of those, like I said, are kind of too new to have reported on data and things like that. And so community-based alternatives to police response to crises is a popular idea among voters, and is being increasingly taken seriously by systems, right? And we see that with funding coming from state and local governments, from formal partnerships with police and other crisis responders and things like that. And so these strong partnerships with impacted communities leading the way really does seem to be the recipe for success, right? With communities, impacted communities and organizations centered in those communities leading the way, it really goes a long way to building trust with folks who might be really, really suspicious of anybody that might be associated with law enforcement or kind of other governmental responses. And these alternative approaches are effective, in a lot of cases highly effective, and effective in both outcome and really efficient in cost, costing a lot less than a traditional police response. And so given this, right, pretty much everyone agrees that these alternatives are worthwhile, that we should be investing in them. They work, they're cost effective. What barriers remain to treating seriously, folks with serious mental illness in the community? Unfortunately, community-based resources remain underfunded. I'm sure most of us can kind of attest to that in our own communities, right? For these alternatives to a criminal justice response, in order for these alternatives to be successful, there has to be resources to provide for them outside of the criminal justice system, right? There has to be resources, treatment options, crisis centers or whatever they are, but there needs to be resources available in the community. When looking for opportunities to help address or mediate or advocate in this area, This is a good opportunity to connect with local community-based organizations who might already be advocating for justice reinvestment. You might also see language like defund the police, right? Where the defund the police obviously has become a very politicized term. But justice reinvestment means something similar. But the idea is that we're taking some of the public safety dollars that are currently allocated towards intervention, right? We talked about how the majority of those dollars are go to law enforcement and system response. Allocating some of those funds to prevention, right? We know that those investments pay off, and we know that there have been significant resources invested in the justice system that could be more efficiently and more effectively used in the prevention. There are also, unfortunately, Medicaid restrictions often result in serious budgetary and legal constraints on services, how long services can be provided, what kinds of services for what need, that kind of thing. And so in this arena, we should be looking for opportunities to provide public comment and or feedback. You can always check with your agency to see if you can use your name, title, agency when giving that public feedback, because experts and folks working on the ground can carry a lot of weight, in giving their opinion. We should also be looking for opportunities to push for local funding to increase, given the restrictions on Medicaid dollars, right? We can't only rely on those dollars for these services, because we know that it's not enough to meet the need that's there. Another barrier is, in a lot of communities, a lack of collaboration and strong relationships with the justice system and with justice system partners. And this is, I'm not putting the kind of responsibility for that on the community-based organizations. A lot of communities have very tense relationships with law enforcement and with the justice system as a whole. And so, that process of building trust and building those relationships can take a lot of time, because we can all think, unfortunately, of communities that have been directly harmed by police and by other justice system agencies. However, when and where trusted, strong partnerships and relationships can be built, having a unified voice with justice system partners is really powerful. Can be really, really powerful, showing that community-based organizations and law enforcement or other justice agencies have a shared goal and are working together can be, as I said, just really, really powerful. And of course, relationship building, at least on paper, is free, right? Of course, it takes time and effort, and not all of us have time or energy or bandwidth or capacity to engage in that kind of thing. But getting to know folks in your communities, getting to know the organizations that are doing work in this area. In closing, here's a quote from Jamila Hodge. She's formerly a federal prosecutor, but now is the executive director of Equal Justice USA. She says, "We continually invest in policing, where the priority is to investigate and arrest so that the system can punish. And this has to be addressed while we build up the infrastructure and resources for the solutions that actually prevent harm," right? So we can't put the cart before the horse, so to speak. All of this infrastructure needs to be built up at the same time, right? We want to promote alternatives to armed police response, but we need to have those alternatives in place, right? If folks aren't going to be getting whatever treatment is available in the local jail or the local emergency room, where are they going to get the treatment that they need? In my county, there's finally an understanding of the need for non-law enforcement response teams and crisis stabilization units. But the recommendation for changes includes embedding a mental health clinician in 911 as opposed to utilizing 988. I can share from a research perspective, there doesn't seem to be consensus yet as to whether 911 or some other number, 988, 411, some kind of other number is more effective. In some cases, the alternative number has been shown to be more effective with the most marginalized folks who just would not call 911. There's just no way that they would call 911. They don't trust any kind of response that would come from 911. So that's something to keep in mind. On the other hand, folks know 911, right? Kids are taught, call 911 in case of emergency. And so kind of the public awareness around 911 being an emergency number is just really prevalent. And it takes a lot of education and public awareness to get those other alternative numbers to catch on. So approaches have challenges, and both approaches have had different measures of success in different situations. So I don't think there's a consensus as far as which is best practice yet. I think we're still kind of figuring that out. 988 is not necessarily non-police, right? Police can still be contacted and dispatched. How care court might affect crisis intervention. Care court, I'm assuming that's a specialty court that deals with mental health, behavioral health issues. Those kinds of specialty courts, I think they've shown some mixed success because folks have to be in the criminal justice system, at least to some extent, right? They'll have an arrest. They may or may not have had some jail time prior to the court and things like that. And so those can be effective interventions if whatever is court ordered, because it's not a sentence, right? But whatever is court ordered, if those services are effective, then that can be an effective approach. I think best practice for suicide response is, I don't know that police are effective in those kinds of situations, right? The best practice there would be to have trained clinician or someone trained in intervention be able to talk with that student and hopefully de-escalate, and then certainly follow up and aftercare is really, really important here, right? Students threatening to harm others, again, police are not often are rarely given the same amount of training and specialized training that other crisis response folks are given. So obviously, if the student was armed or something like that, that might require a different kind of response. But if it's a student just kind of but threatening to harm themselves or other people, a trained crisis responder would be best. On average, in the state of California, police receive about 15 hours of training on about 40 different subjects, right? And so that just doesn't allow for, because there's a lot that they have to learn about and be able to respond to. And so crisis response is trained crisis responders, including clinicians and things like that, certainly have more training to deal with situations like that. Is there any pushback from police on these new models? Yeah, I mean, there's pushback from various stakeholders, right? But I think that I wouldn't say that police have been, stonewalling across the board, right? Depending on whatever the kind of climate is in your particular community, lots of people can have different stakeholder groups can have different kinds of pushback, right? You might have pushback from the public who really want a police response. Police make them feel safe, right? That's not the case across the board for all communities, but some folks want that. There could be pushback from police who might hear something like justice reinvestment, think that what's being talked about is defund the police, right? Which is, in most cases, an anti-police kind of position, right? And so that can be they could be like sticky conversations, right? There can also be situations like Bernadita was sharing about the situation in Contra Costa, where police did go, they were paired up for all the responses, and then over time kind of scaled back their involvement. And I wouldn't be surprised if part of that was trust building, right? Both on the relationship level, but also trust that this program is going to do what it says it's going to do, right? And that it's actually going to serve public safety. And so, yeah, they can be complicated situations. What should armed police responders be responding to? This is a matter of debate and opinion, and it's an area that's been researched as well. Most people want a police response in the case of an armed situation or where violence has happened, and we can see that by, if we remember, on the cahoots, right, 311 calls out of 24,000 needed police backup, right? So very few. Most of these situations can be de-escalated without the need for force or use of force. Well, feel free to reach out in the future if there's anything I or the CARE TA Center can do. And again, thank you all for joining and for your time today.